Hey everyone, and welcome back for another deep dive. Today we're going to be tackling something that's, well, pretty universally relevant, the U.S. healthcare system.
A pretty big topic to tackle.
It really is. But we're going to break it down from those basic concepts like health and wellness. You hear those all the time, right?
All the time.
To navigating, the whole healthcare maze, and even, believe it or not, dipping our toes into the world of health policy.
Which, trust me, is a lot more interesting than it sounds.
I bet it is. We've got some fascinating sources here that really break it all down.
Absolutely, and they highlight just how much of an impact understanding this stuff can have on your own health.
Exactly. Okay, so let's kick things off with something I think everyone can relate to. I mean, we hear these terms everywhere. Health promotion, disease prevention, and then there's wellness.
Right, right.
What do they even mean? I mean, really?
Well, they're actually pretty straightforward when you break them down.
Okay, break it down for me.
So, our sources use the example of, say, encouraging exercise to prevent heart disease.
Okay, that makes sense.
Right, pretty straightforward. You're actively promoting health by encouraging a behavior that prevents a specific disease.
Got it. So that's health promotion and disease prevention in a nutshell.
Exactly.
But then there's this whole other thing, wellness.
Right, so that's where things get a little more,
Complex, like health plus.
yeah, I like that, health plus.
Yeah.
It's not just about avoiding getting sick, it's about, making choices that actively promote your well-being.
Okay, so it's more proactive, not just reactive.
Exactly. It's about your physical health, sure, but also your mental and social well-being.
So instead of just like skipping the drive-through, you're actively seeking out, I don't know, a yoga class or something.
There you go. Or maybe you finally start that meditation app you've been meaning to try.
Okay, I'm starting to get it. It's about being intentional with your choices, right?
Right. And it's about finding what brings you joy, reduces stress, that kind of thing.
So it's personalized too, not just a one-size-fits-all approach.
Exactly. And this whole idea of wellness ties into something else. Our sources highlight the Healthy People initiatives.
Oh yeah, I've heard of those. They've been around forever, right?
Try since 1979.
No way. Seriously.
Yep, for decades they've been setting these goals to improve the health of all Americans.
Okay, but how do you even begin to do that? That's a massive goal.
It is, and it changes over time, right? But essentially, it's about identifying the biggest threats to public health and then, figuring out the best strategies to address them.
So it's kind of like a roadmap for a healthier nation.
Exactly.
That's actually a good analogy.
It's constantly evolving based on, new research and emerging health challenges.
That makes sense. So what are some of the things they're focusing on?
Well, it runs the gamut. Things like reducing chronic diseases, promoting mental health, addressing health disparities.
Health disparities, that's a big one.
Huge.
The idea that not everyone has equal opportunities when it comes to health, right?
Exactly, and that's a key part of the Healthy People initiatives, trying to level the playing field so that everyone has a fair shot at a healthy life.
I like that, a fair shot, because it shouldn't matter your zip code or your income level. Healthcare is a right, not a privilege.
Right, 100%.
But here's the thing, and our sources point this out. Despite all these efforts, the U.S. still has a way to go.
That's right, there's room for improvement.
We're talking about things like life expectancy and infant mortality rates, which, frankly, are kind of shocking when you compare us to other developed countries.
It's true, the data is out there.
So we're doing some things right, obviously, but clearly there's work to be done.
And that's why understanding these initiatives, these concepts, is so important. They're not just, abstract ideas, they directly impact our lives.
I like that you said that. It's a good reminder that it's not just about, reading statistics, it's about real people's lives.
Exactly. It's about how long and how well we live.
Which brings us to another really intriguing concept from our sources, and it's something that I think a lot of people don't even realize is a factor: the social determinants of health.
Right. It's not just about individual choices.
It's like this whole web of factors that influence our well-being, things that are often, outside of our immediate control.
Exactly. And our sources break it down into 5 key categories.
5. Hit me with them.
Okay, so we've got economic stability, education access and quality, healthcare access and quality. That one's a bit of a mouthful.
Say that again, but slower.
Healthcare access and quality. So it's not just about being able to see a doctor, it's about the quality of care you receive.
Right, makes sense.
Okay, and then we've got neighborhood and built environment. And finally, social and community context.
Okay, so 5 categories, that's a lot to unpack. But the point is, it's not just about, eating your vegetables and exercise.
Right, those things are important, but it's bigger than that.
It's about recognizing that our environment, our opportunities, even our zip code can have a huge impact on our health.
It's like where you live determines your access to healthy food, safe housing, even green spaces.
And then there's the whole education piece. If you're not informed, it's harder to make healthy choices, right?
Absolutely. And that's where access to quality education comes in.
Okay, so walk me through this. What kind of things fall under, say, economic stability when we're talking about health?
Sure. So it's not like having a bigger bank account magically makes you healthier.
Right, because trust me, I know
Mm.
plenty of wealthy people who are not exactly the picture of health.
Right. But think about it this way. If you're constantly stressed about money, about making ends meet, are you really going to prioritize your health?
Probably not.
Exactly, because when you're struggling to put food on the table, buying fresh produce or like a gym membership, those are
It's like a
luxuries.
domino effect, one area impacting another.
And that's what makes these social determinants so important to understand because they highlight just how interconnected everything is.
Right, and it's not about blaming anyone. It's about recognizing that these factors exist and then, trying to find ways to address them.
Exactly, because knowledge is power.
It really is. So we've got these foundational concepts down: health promotion, disease prevention, wellness, and these all-important social determinants of health.
The building blocks.
Exactly. But how does it all actually work in practice?
That's where things get really interesting.
I bet they do. Because now we're getting into the nitty-gritty of healthcare delivery, the organizations, the systems, the
Get
processes.
ready for a wild ride.
So we're talking healthcare delivery. That means organizations, right? The folks who make sure hospitals aren't just, winging it.
Exactly. And our sources dive into some big players you might not even know about. Like, have you ever heard of the Joint Commission?
The Joint Commission
Ro-
rings a bell, but I couldn't tell you what they do.
Yeah, they're kind of behind the scenes, but they wield a lot of power. They're all about setting the standards for quality and safety in healthcare.
Okay, so, like, they're the rule makers.
Exactly. They come in and inspect hospitals, nursing homes, all sorts of healthcare facilities to make sure they're meeting those standards.
Wow, so it's like a seal of approval almost.
Exactly. If you see a hospital bragging about being Joint Commission accredited, it means they've passed a pretty rigorous inspection process.
Okay, so they're keeping hospitals honest. What about NCQA? That's another one I've seen, but I'm not sure what it stands for.
That's the National Committee for Quality Assurance.
Catchy. So what do they do?
They're all about measuring and improving the quality of healthcare.
Okay, how do you even begin to measure something like that? Quality seems kind of subjective.
Well, they use a bunch of different tools like patient satisfaction surveys,
Makes sense.
but they also have this thing called HEDIS, which stands for Healthcare Effectiveness Data and Information Set. Basically, it's this massive set of performance measures, like 90 different aspects of care they look at.
90. They're not messing around.
Nope. They're looking at everything from how well chronic conditions are managed to patient experience to preventative care.
So it's not just about whether you get treatment, but how well it's done.
Exactly. And it's about making sure quality is at the forefront, not just an afterthought.
Okay, I'm liking what I'm hearing.
Yeah.
What about this magnet recognition thing?
Oh, that's a big one, especially for nurses.
Really? What makes a hospital magnetic?
It's all about nursing excellence.
So, like, the best to the best when it comes to nursing care.
Exactly. Hospitals have to go through this really rigorous process to earn magnet status, demonstrating excellence in things like nursing leadership, clinical outcomes, patient satisfaction.
Wow, so it's kind of like the gold standard for nursing.
Exactly. And
Oh.
the studies have shown that magnet hospitals tend to have better patient outcomes overall.
So if you're looking for a hospital, magnet status is definitely something to keep an eye out for.
Absolutely. It's a good indicator that they're serious about quality nursing care, which, let's be honest, can make a world of difference.
No doubt about that.
Yeah.
Okay, let's switch gears a bit and talk about the not-so-fun part of healthcare, the financial side.
Yes, the dreaded money talk.
Right. And our sources mention all these acronyms: FFS, DRGs, REs. It's like alphabet soup.
I hear you. Healthcare loves its acronyms. But they're not just there to confuse us, I promise. Understanding them can actually help demystify how the system works, which can be empowering.
Okay, I'm all for demystifying things. Break it down for me. What are these acronyms all about, and how do they affect, the average person?
Sure, so it all comes down to how healthcare is paid for.
Right, because it's not exactly free.
Unfortunately not. So fee for service, or FFS, is the traditional model, and it's pretty much what it sounds like. You pay for each service separately.
So like every doctor's appointment, every test, every procedure.
Exactly. And while that might seem straightforward, it actually led to skyrocketing healthcare costs.
How so?
Well, because under FFS, there was no real incentive to control how many services were provided, right? More tests, more procedures meant more money for healthcare providers.
Right, so it was kind of a recipe for overtreatment.
Exactly. And that's where DRGs come in diagnosis-related groups.
Okay, so like a diagnosis dictates the cost.
Kind of. With DRGs, hospitals get a fixed payment for each patient based on their diagnosis, regardless of how many tests or procedures they end up needing.
Interesting. So it's about incentivizing efficiency and preventing unnecessary treatments.
Exactly. It's like shifting from a buffet model where you can just load up your plate with whatever you want to a prix menu where you get a set meal for a set price.
I like that analogy. Makes total sense. And what about RUGs? Where do they fit in?
RUGs are specific to long-term care settings, like nursing homes.
Okay, so not hospitals.
Right. RUGs stand for Resource Utilization Groups, and similar to DRGs, they determine how much a facility gets reimbursed based on the needs of the resident and the level of care required.
So it's all about making sure the payment aligns with the actual care provided, regardless of the setting.
Exactly. And it's about making sure those who need more intensive care are getting the resources they need.
Makes sense. Okay, so we've got these payment models, but who decides how they work? Is it just up to the hospitals and insurance companies?
That's where things get even more interesting because it's not just up to them, it's also influenced by, you guessed it, health policy.
Right, because there are laws and regulations around all of this stuff.
Exactly. And this is where things can get a little complicated. But it's important to remember that these policies, these laws, they're not just abstract concepts. They have real-world consequences for all of us.
Okay, so let's dive into some examples. First up, IPA.
Ah, yes. IP, the one everyone's heard of, but probably couldn't tell you what it stands for.
Guilty as charged. I know it's got something to do with privacy, which is obviously
Yeah.
important, but beyond that.
Well, IPK stands for the Health Insurance Portability and Accountability Act, and it's basically like a superhero for your medical information.
Okay, tell me more.
So imagine you lose your job or you switch jobs and you're worried about your new employer finding out about your, medical history.
Right, that's scary to even think about.
Exactly. But HIPAA prevents that from happening. It keeps your medical records confidential and gives you rights over your own health information.
Wow, so it's not just about keeping things private, it's about empowering patients to control their own information.
Exactly. And the portability part of HIPAA, that means that you can maintain health insurance coverage even if you lose or change jobs.
Oh, wow, I never realized that was part of HUP. So it's about protecting access to coverage, too.
Exactly. It's like this multi-layered superhero
Hmm.
fighting for your privacy and your right to health care.
Love it. Okay, what about EMTALA? That one sounds familiar, but I'm drawing a blank.
So EMTALA stands for the Emergency Medical Treatment and Active Labor Act, and it's all about preventing something called patient dumping.
Patient dumping, that sounds awful.
It is. It's basically when a hospital transfers a patient to another facility for financial reasons rather than medical necessity.
Wait, hold on. So if a hospital doesn't think you can pay for treatment, they can just ship you off somewhere else.
Sadly, that used to happen a lot, especially to uninsured or underinsured patients.
That's outrageous. So how does EMTALA prevent that?
Basically, it says that anyone who shows up at an emergency room must receive a medical screening and stabilizing treatment, regardless of their insurance status or ability to pay.
Thank goodness for that. So it's about ensuring everyone has access to emergency care, no matter what.
Exactly. It's about recognizing that everyone deserves basic human dignity and access to healthcare, especially in emergency situations.
Couldn't agree more. Okay, last but not least on our policy tour, we've got PSDA.
This one is all about patient empowerment.
Okay, oh, tell me more.
So PSDA stands for the Patient Self-Determination Act, and it basically requires healthcare institutions to inform patients about their right to make decisions about their own care.
Okay, so it's about making sure patients understand their rights.
Yes, and that includes the right to refuse treatment, even if it's life-saving.
Wow, that's huge. It's their body, their health, their choice.
Exactly. And this ties into the concept of advance directives, which are legal documents that allow you to outline your wishes for medical care if you become unable to communicate them yourself.
So it's about making sure your voice is heard, even in difficult circumstances.
Precisely. It's about giving patients autonomy and control over their healthcare journey.
I love that. So we've got HIPAA, protecting our privacy, EMTALA, ensuring access to emergency care, and PSDA, empowering patients to make their own decisions.
It's all connected.
It really is. Okay, so we've covered a lot of ground here, from those behind-the-scenes organizations to the ins and outs of healthcare financing and some key policies that impact us all.
It's a lot to digest for sure.
It is, but it's important stuff. But you know who we haven't talked about yet? The ones on the front lines, the ones holding it all together, nurses.
Ah, yes, nurses. The heart and soul of healthcare.
So we've talked about the organizations, the policies, the whole system, really.
The good, the bad, and the confusing.
Right. But now let's talk about the people. Because healthcare isn't just about, charts and regulations. It's about the human connection.
Absolutely, and no one embodies that more than nurses.
They're the ones on the front lines, the ones who are there with patients every step of the way.
From the moment you're admitted to the hospital to the moment you're discharged and everything in between.
And even after that. Right. I mean, think about home health nurses, school nurses, all the different settings where nurses are making a difference.
Exactly. And our sources really delve into the complexities of their roles, the incredible amount of knowledge and skill they bring to the table.
Because it's not just about, taking temperatures and giving medication.
Right. It's about so much more than that.
Okay, so break it down for me. What does a nurse's scope of practice actually entail?
Well, it varies depending on their education and specialization, of course.
Right, because we've got RNs, LPNs.
Nurse practitioners, certified nurse midwives, the list goes on.
It really does. So how do all those different roles fit together?
Well, think of it like a team, right? Each member has their own unique skills and responsibilities, but they're all working together towards the same goal, providing the best possible care for the patient.
Makes sense. So what are some of the things that all nurses, regardless of their title, are responsible for?
Well, first and foremost, they're advocates for their patients.
What does that look like in practice?
It means listening to their patients, understanding their needs, and then communicating those needs to the rest of the healthcare team.
So they're kind of like a liaison between the patient and the doctor.
Exactly. They're the ones who are often spending the most time with the patient, so they're uniquely positioned to understand their concerns and make sure their voice is heard.
That's huge. Because I know from experience, it can be intimidating to speak up in a hospital setting.
Oh, absolutely, especially when you're not feeling well. But nurses are trained to be those patient advocates, to make sure everyone gets the care and attention they deserve.
I love that. So advocacy is key. What else?
Well, nurses are also responsible for a lot of the hands-on care that patients receive.
Right, like actually administering medications, changing dressings.
Exactly. And they're also monitoring patients' vital signs, assessing their condition, and reporting any changes to the doctor.
So it's a lot of observation and critical thinking too.
Oh, absolutely. Nurses have to be able to think on their feet, make quick decisions, and adapt to constantly changing situations.
It's like they have to be a million different things all at once. Caregiver, advocate, educator, decision maker.
Don't forget therapist.
Right, because they're dealing with people at their most vulnerable, both physically and emotionally.
It's an incredibly demanding job, both physically and emotionally, but it's also incredibly rewarding.
No doubt about that. So let's talk about the education piece, because I think there's a misconception out there that, all you need to be a nurse is a caring heart.
Right, and while compassion is definitely important, it's not enough on its own.
Okay, so what kind of education do you need to become a nurse?
Well, it depends on the type of nurse you want to be.
Right, because we talked about all those different roles.
Exactly. So you've got your licensed practical nurses, or LPNs, who typically have a one-year diploma or certificate program.
And then there are registered nurses, or RNs.
Right. And they can either get an associate degree in nursing, which takes about 2 years, or a Bachelor of Science in Nursing, which is a 4-year degree.
So there's a pretty big range of educational paths, even just within those two categories.
Exactly. And then you've got advanced practice registered nurses, or APRNs, who have at least a master's degree and often a doctorate.
Wow, so we're talking about nurses with the same level of education as some doctors.
Exactly. And they're able to provide a lot of the same services as doctors, like diagnosing and treating illnesses, prescribing medications.
That's amazing. So the nursing profession really runs the gamut, from entry-level positions to highly specialized roles that require years of education and training.
It really does, and that's part of what makes it such a dynamic and rewarding field. There's always something new to learn, always ways to grow and specialize.
Okay, so someone's listening to this and they're thinking, wow, nursing sounds like an amazing career path. What advice would you give them?
I'd say go for it. It's a challenging but incredibly rewarding profession, And there's a huge need for nurses right now, so it's a great time to enter the field.
I bet. And with so many different specialties to choose from, you're bound to find something that aligns with your interests and passions.
Exactly. Whether you're interested in working with kids or in critical care or in research, there's a place for you in nursing.
I love that. Okay, so we've covered a lot of ground in this deep dive on the U.S. healthcare system. We've talked about those fundamental concepts like health promotion and social determinants of health.
We've explored the complex world of healthcare delivery from those behind the scenes organizations to the ins and outs of how it's financed.
We've demystified some key health policies that impact us all.
And we've shined a light on the incredible work of nurses, the unsung heroes of healthcare.
All of that in just under an hour.
We covered a lot.
It's been a whirlwind. But hopefully we've given you a better understanding of how this complex system works, and more importantly, how it impacts your life.
Exactly. Because knowledge is power, especially when it comes to something as important as healthcare.
Couldn't agree more. So to our listeners, stay curious, keep asking questions, and remember, you are your own best advocate.
And never underestimate the power of a good nurse.
Amen to that. Thanks for joining us on this deep dive, everyone. Until next time, stay healthy and informed.